I started trying to get pregnant with my husband about a year after we were married. Like most women, I never thought there'd be a problem. I was only 31 and just thought we were going to try and have a good time with it and see what happened. About 7 months or so into that, I just had a feeling that something wasn't right. All the internet searches and doctors' advisements said if you were under the age of 35, you should be waiting about 12 months to be considered to have an infertility problem. But I couldn't shake the feeling that something was off. So I first met with my gynecologist and did the basic tests of some blood work and some more extensive testing of looking through sonograms and other tests. And he also had then referred me to some reproductive endocrinologists in the New York City area and met with Dr. Gleicher in the summer of 2008. So our first consultation was quite thorough. There were a lot of questions asked of myself and my husband. We reviewed the testing and medical records that we had brought in, and Dr. Gleicher reviewed them and had some conversations about our own medical history as well. It was determined at that meeting that he would like to run some further tests of his own, and definitely had some conclusions and thoughts that other doctors hadn't brought up to me in the past. He was the first to discuss a link between some autoimmune issues that I was having and what my ovaries and uterus was looking like, and it was the first I had ever heard of that, and it was sort of a light bulb went off that there actually was something to the situation. He also did not seem to take no for an answer, meaning that he was determined to figure out exactly what was wrong with me and why I was not able to conceive on my own, and also seemed quite confident that I in fact would become pregnant, that my chances were good. And so we left there feeling quite elated that even though we were sort of handed some uncomfortable, perhaps bad news, that there were a handful of things wrong with me, or I should say issues, but that we had a plan, and that he recommended due to the stage 4 endometriosis that I had, and some other issues that I had a bicornuate uterus and dermoids in both of my cysts. He suggested that the only way to move forward was to plan for it going directly to IVF, which we then got ready right away and started to plan for an IVF cycle about 2 months later.